It's often said that the first casualty of war is truth. The same saying could apply equally to health. The disruption of health services across Ukraine has been catastrophic, compounded by displacement and the fact that millions of people remain trapped in conflict areas, unable to move. This puts health workers, care workers, services and infrastructure, and the health of millions of Ukrainians at severe risk. We salute the nurses caring for newborns in hospital basements, ambulance drivers and paramedics rescuing people from bombed buildings, medical teams conducting surgery and delivering babies under fire. You have seen it all. But even worse than disruptions to health services are attacks on healthcare. WHO has now verified 191 attacks on healthcare, with 75 deaths and 54 injuries. Hospitals, clinics, ambulances, health workers, patients. Let's be clear, attacks on health are a violation of international humanitarian law. This is utterly unacceptable. WHO has more than 80 staff in Ukraine, supported by hundreds more in neighboring countries and around the world. Prior to the conflict, WHO was working with the Ministry of Health to prepare for the worst-case scenario, pre-positioning supplies in hospitals. Within days of the Russian Federation's invasion, we sent in medical supplies, trauma kits, and more from our logistics hub in Dubai, mobilizing also millions of dollars. So far, we have delivered more than 316 metric tons of medical supplies, supporting care for 7.5 million people and more than 200,000 surgeries. We're also working in neighboring countries to support the health needs of the more than 5 million refugees who have now fled Ukraine. WHO supports proposals
Dr. Tedros,
to provide...
Dr. Tedros, can I ask you to conclude, please?
Yes, just a few seconds. WHO supports proposals to provide Solidarity Trust Fund, and we thank donors who have supported the health response so far, and we hope donors will make this appeal today a success. We call for human rights and international humanitarian law to be upheld, to allow for safe and sustained humanitarian assistance. We call for an immediate humanitarian ceasefire for Mariupol and other encircled cities to allow civilians to evacuate and to allow WHO and our partners to deliver vital supplies and assess health needs. We call on the Russian Federation to stop this war. There is only one remedy for the disease of war: peace. Muir Dilia Ukraine. Peace for Ukraine, and I thank you.
Thank you very much. And now we are closing that part and we are moving to the pledging sessions. I think what we've heard